Welcome to K6 Wellness Revolution, where we believe health is worth fighting for. This podcast focuses on all things related to natural health, wellness, and vibrant living. We know your time is valuable, and I'm honored that you're spending some of it here. So get ready, because the Wellness Revolution starts right now.
Welcome to the K6 Wellness Revolution podcast. My name is Elena, one of the practitioners at K6 Wellness Center in Dallas, Texas, and I'll be your host as we discuss all things health and wellness. On today's episode, we will be taking a deep dive into some of our new services we are offering here at K6, which are neural therapy, prolotherapy, and ozone. But what is neural therapy? How does ozone work? What makes prolotherapy different from neural therapy? Well, we're going to be answering all these questions and so much more. So let's jump in. Hello, Sharon.
Hello, Elena.
I am excited to kind of get schooled here on all things neural therapy, prolotherapy, ozone, because I've been on the receiving end quite a bit. But as I have even told my clients, there's very little I know about it. So I'm here to learn just as much as our listeners are.
Yes, you have been my very willing participant, human pincushion, crash test dummy, all of the things. Really, for the last year and a half, 2 years almost, that we've been kind of getting ready to get this going. So
yes. Well, let's just go ahead and start with the most basic question that I've already been asked a lot by clients is, what is neural therapy and why did you decide to bring it to K6?
Well, that is a good starting point. And I think it depends on really who you're talking to as to what definition they're going to give you for what their neural therapy is. But it's it's a way to help reset the autonomic nervous system. Okay. And what we do is we're using injections, mainly subcutaneous, but many of them can be intramuscular or deeper injections. And what we're doing is we're injecting into certain places, depending on what our project is. We're injecting something called procaine, and procaine is a local anesthetic like lidocaine or novocaine. It's in the cane family. And we're using that to kind of help reboot a certain area of the body. So the autonomic nervous system as it relates to certain organs, tissues, glands. And one of the main things that we want to do is get rid of what's called interference fields. And interference fields, it kind of sounds like what it is. Like if you think about football and we say, oh, that was interference. Well, somebody on the defense tried to block somebody on the offense by like grabbing a hold of them and messing them up, right? Like you can block it in the air or whatever. I'm not a football person, but I do know that.
That was good enough.
Okay, good enough. But with interference fields in our body, it could be scar tissue. It could be an infection. It can be something else going on, right? Like inflammation that causes either an organ to be inflamed or a gland to not function, or it can be, like I've had surgery in this area and I have this keloided scar and now I can't bend over or whatever. And C-section scars are a big one that we see a lot of, right? And women talk about how hard it is to function normally, whether it's enjoying sex or they suffer low back pain or they have, some sort of pelvic floor issues. And when you see a C-section being done, it's like, yeah, no wonder. I mean, it's barbaric, the way they pull your muscles apart. But procaine is used to both alleviate the pain because it's an anesthetic, but it also acts as a catalyst for healing by addressing interference fields, by helping to release the fascia and helping to kind of not dissolve scars, but break up the inflammation that's below it. Any area of the body where it's disrupting normal physiological function. So, and again, interference fields could be It could be from a car wreck, like whiplash. It could be vaccine injection sites for somebody, they had a reaction. It's not necessarily, oh, you have to have this huge scar that goes end to end or side to side. The size of the scar does not always determine how much of an interference field we have.
And
So
it's
it's,
not always just for pain, right? Because
oh,
they
for
could
sure.
it could just be an area that you deem needs the treatment, but the person's living with autoimmune symptoms or just
Mhm.
chronic tension, right? I mean, you tell
Absolutely.
me.
No, that's exactly right. And even emotional trauma, right?
Oh,
And that
yes.
is one of the things that we see is when you're dealing with certain areas of the body. And I had it happen just recently doing an injection for somebody who had a cough, and there's a certain neural therapy injection where we're going into the infraspinatus muscle, which is kind of in the back of the shoulder, under the arm. And you're not going into the lung, right? It's not a deep shot, but the woman started weeping immediately. And in my head, I went, oh, we have an emotional reaction. And I didn't warn her this could happen. And so we had to talk through it. And I've had an emotional reaction to some neurotherapy shots that I had. And it's almost reflexive because it's kind of a
Yes.
joke that I am the ice queen. I don't cry. That's not true. But there was a point in time where I didn't. But I'm not a
Listeners,
big
it's healthy to cry.
I know. And I know that. And I raised 4
Yeah.
daughters, and I tell them all the time, go ahead and cry. It won't do a darn thing to fix the situation, but you will feel better. You've got to get it out. And crying is oftentimes an expression of emotion. It's not an emotion, it's an expression of emotion. My husband will laugh so hard he cries, but it's all happy. And some people cry from anger, some people cry from pain, but crying is a show of emotion.
And
And
I
yeah.
know I've experienced it. I've had an emotional release, and when I didn't even feel a particular emotion. I just needed to cry. It's
Mhm.
weird, but it's good. You feel better. And this is in relation to the injections, but also, hey, just in life in general, cry it out.
And I think also, if as we look at this holistically and from a naturopathic standpoint, we talk about um, emotions being seated or rooted in certain areas
Mhm.
of the body, and like anger is in the liver. And you could have a ragey moment. You could have those criminal murderous thoughts for whatever, with justice not performed, or a betrayal, or um I don't know, it could be anything, right? And sometimes neurotherapy allows it to come to the surface almost. It's like it brings it to your conscious awareness, because it's not that you have to go get justice, or that you have to get revenge, or you have to um start all over with the grieving process in the case of sadness. But sometimes it's just allowing the body on a conscious level to go, okay, yeah, that happened, and we're dealing with it, and it passes on through, and it gives the body more room to heal, both emotionally and physically. So yeah, just being able to acknowledge things, right? That's why sometimes
Mhm.
when people can't admit when they've done wrong, that's the bigger problem. It's not being wrong that's the problem. It's the fact that you can't admit it. And there's
Yeah.
something so freeing in being less than perfect, right?
Well, and
Um,
just being able to release it. So releasing on a
mhm.
physical, well, an emotional level because of this physical injection. And I love that it actually promotes long-term healing. You don't just get that momentary relief. You
Right.
actually get that long-term aspect of it. And that I know a lot of us are chasing
Well,
for various reasons.
that brings up a good point. Like, procaine itself only has a 20-minute half-life in your system. So the anesthetic part of it may only last 20 minutes, but the reset that it performs, right? The release of scar tissue, the correction of an interference field, that has ongoing and long-term results. And that's more what we're after.
Yeah. No, it's
So,
just so exciting. But what
mhm.
motivated you to incorporate injections into the practice? And how is it going to enhance our clients healing?
That's okay. So I, being a naturopath, love everything that's out of the box. I live out of the box
Mhm.
in every sense of the word. Nothing
There
about
is
my
no
life.
box.
Yeah, there is no box. It got shredded a long time ago. Nothing about my life is normal.
Mhm.
um, what really took me here, I think, was a trip to Switzerland, and it had a lot to do with learning about thermography from the German biological doctors and in Switzerland, and learning about neural therapy. And it just really sparked something in me, because things that are maybe easier to access but have a broad application, I'm all about that. Whether it's a food, a tool, a practice, I want something that has broad application and is accessible. And there are a lot of things that they do in Europe that we don't really do here, or you can't access. But neural therapy is something that is done here in some form or fashion. Many people do it. So when I saw neural therapy, and then I started reading up on it, and one of my favorite doctors was talking to me about it, I was like, this is so cool. And we need this tool, because if you just look at pain, like people come in with chronic pain, and I've been there. I've been at that point where you put your feet on the floor and stand up, and everything hurts from the bottom of your feet to the top of your head. That's a horrible feeling. Or you have this chronic joint issue that you just, no matter how many massages, how much ibuprofen, how many chiropractic adjustments you go and you get,
Mhm.
it doesn't ever resolve. And neural therapy is a tool. It doesn't fix everything, right? But it is a tool that is really helpful for unwinding a lot of the entanglements that we end up with over time through toxic exposures, through traumas, through sickness, through surgeries, just living.
And I like
And
that you said
so,
unwind, because that actually
yeah,
is what it feels like. That really
yeah.
is.
Yeah, absolutely. So neural therapy really piqued my interest. And then in 2023, I went and took my first class and immediately started injecting. It was like, oh yes, this is amazing. And honestly, like, one of my daughters who has she has electrohypersensitivity. And so she is a very sensitive person. And she had an immediate autonomic reset from the procaine. And for her, it is definitely something that gets her to the parasympathetic state, because she stays just a little hypersensitive all the time. And so it's been a really valuable tool. And I think it's taking her to a higher place of function as well. She does a lot of things. And this is yet a tool, that is also very valuable for that. So giving people something that we can do to address, multiple issues, but help unwind, like you said, some of the years of accumulation of inflammation. And then how many times do you meet people and you're like, man, do you ever get out of the operating room? Because they've had so many surgeries, and
Yeah.
all of those scars make a difference in your body. So yeah, that's a big, big deal. But that's kind of what motivated me, was understanding this is something that is accessible and applicable and honestly, like low risk, high reward.
And very
I'm
affordable compared
all
to all
about
the other
that.
injections out there. I mean, this is
Absolutely.
so much more affordable.
Absolutely. And it enhances, healing just by um, helping to not just provide in the moment relief from pain, but it goes back. Like we're going back, we're taking you back before the pain was so bad. We're taking you back before organ dysfunction was so severe.
Yeah.
So it is something that I think accelerates the healing process. It's not like we've been doing this for decades and decades here in our practice, but it definitely plays a role in both mental and physical health.
Yeah. And that's just the neural therapy. Because
Yeah.
there's so much more than procaine injections.
Yeah.
What else do you inject? I love this next one.
Yeah. Well, and in a lot of places, I mean, when I was taught originally, the procaine is mixed with homeopathics, but you can't get those in America right now because, we're so amazing. But I mean, I love America.
It's just
I
nice
just
to
think that
have some more options, and
I would
it's
like to have
starting.
some freedom of choice in healthcare
Yes.
more so
Yes.
than we do now. So come on,
Yes.
RFK. But I
Yes.
think that I think that looking at all the other things, yeah, we can inject ozone.
Yes,
And
that's the one I wanted to hear about.
yeah, so ozone it's used in the food industry a lot. It's a disinfectant. So people think of ozone, that's air pollution. No, ozone is what kind of tries to correct air pollution. And we see ozone used in healthcare, in dentistry a lot. And it's also used for like anti-aging, regenerative medicine. And I think it's used in oncology some too. Ozone is antimicrobial. It will kill some bacteria, some viruses, some yeast or fungal overgrowths. It doesn't kill everything, but it does have antimicrobial value. So if you have chronic infections or you have even inflammation, right, without infection, ozone can be very helpful because ozone relieves both infection and inflammation. And like in dentistry, they use it sometimes to get like up in the gums or where there's anaerobic type stuff going on. And sometimes if you don't have a lot of blood flow to an area, it's hard to access that, right? So if you're taking antibiotics, how are you going to really get it into an area where there's not a lot of blood flow and you don't have that drug in good. I mean, maybe you do have the drug in systemic circulation, but it's not able to access the area. Well, ozone gas can do that, or ozonated water. Even using ozonated olive oil as, kind of like to put on the gum line or on wounds. The way that we use ozone, it's so interesting. You can inject it. So here, what we may do, let's say one of the most common ones we're doing is people's sinuses. So you go in with a little bit of procaine in the sinus area, whether it's subcutaneous and superficial around the eyes, or one of them we go up, through it sounds awful, but truly it's not. It's not. But we go in right in front of your canines up into the maxillary sinus area and inject a little bit of procaine, and then we push a little ozone gas behind it. And it's funny because it kind of poofs up your cheek a little bit because you do have that gas. But everyone who has had that has said, wow, I can breathe so well. You're welcome. It is really good. My husband, being a mold inspector, is constantly exposed, and we have a huge routine that we make him go through, both with how he where he takes off his clothes and what they get washed in, and how he does his sinus rinse and showers, and just to protect his health, because he had a sinus infection turn into viral meningitis when we were but young babes, barely married, a few years. And we didn't know what we didn't know back then, but realizing he's a high risk, and he had meningitis one other time, and that's no fun. And so I have even though he has needle trauma because he was raised in the cattle business and I think he got stabbed with too many needles, he has he has let me voluntold him into taking the injections for his sinuses, and he's just floored with how much better his breathing is and how much more effective the sinus irrigations are going for him. So it will have ongoing value for him, and it's not something we do all the time. We don't have to do it every day. So,
and I want to just add right there, yes, this requires needles. And anybody who has heard me talk or knows me well knows that I do not like needles. Like I have a lot of PTSD with needles. I hate them. But I
Yes.
was intrigued enough to try this, and I trust Sharon enough to be like, okay, I hate this, but we're going to do it. And the beautiful thing is, there's not very many other things in life where if you have to get stuck, you get numbed too. And that's what's just so pleasant about this experience, as pleasant as it can be, is even when you're doing the ozone, there's a little procaine first, and the needles are not big. So
No,
anyone
we're
who's hearing
using
this and
little
gets
needles.
queasy about needles, just try to get past that so you can absorb the information. It's really worth it, and it's not traumatic. It's
What
releasing that.
Yeah. So what we hear more often than not is, oh, that wasn't nearly as bad as I thought it was going to be. Everyone's just so pleasantly surprised. It's like,
Yes.
that's it. That's all it
Yep.
is. Because
Yep.
we're not piercing organs, right? We're going into spaces, and it's fairly painless.
You're right. It's not even as bad as if you've had dry needling where you're going into trigger points. I mean,
Oh,
that's
for
a
sure.
lot more dramatic than this.
We do have a few trigger point
Of course,
injections, but that's not what
but
we're talking about right
that's
now.
not the usual.
Yeah, yeah. But
So
the ozone definitely, has many applications, even limb bagging. So for people who have gangrene or ulcers and poor circulation, like for varicose veins and spider veins. Now, this is not, I don't think it's a CDC approved, but the whole idea in medicine in America is supposedly first do no harm. Well, you're not going to harm anybody with ozone. And that's one of unless they like inhale it into the
Right.
lungs, which is a terrible idea. Don't ever do that. But that's not what we're doing. So we even have special silicone bags that we can wrap limbs up, whether it's a foot or a hand or a leg or whatever part of the body. And it does require that you go get the treatment, daily for the time that it's needed. But I mean, I've seen pictures of people saving limbs. And so for people with diabetes, especially, that's a microvascular disease. So your circulation gets compromised very much so. That's why you have so many amputations with diabetes. And so if we're able to improve circulation or even save toes and feet and fingers, that's a big, big deal.
That is.
Yeah. So ozone is really exciting.
Yeah, I love it. And also affordable.
It is affordable. Yeah.
So a lot of people, I feel like, have heard about prolotherapy. I know I had heard about that one. That's probably one of the first injection things that I was aware of. How is neural therapy different from prolotherapy?
So prolotherapy is mainly using a 5% dextrose solution. And we're really kind of limiting that to musculoskeletal issues. So joint pain, like, oh, I pulled a muscle, I have this tendon or ligament issue. And so we're going in and you're using a very short needle. These are all very short and like a 1/2-inch needle. So we're not going very deep. And we're looking to reset the nerves that innervate different muscles. So what the dextrose does is it kind of acts like an irritation, right, to an area. Well, that's going to bring the immune system in to go, okay, we're here. What do? We got to fix this. It's a refocus. And this is mainly something we do by feel because, again, we're not doing deep injections. So if you came to me and you said, oh, my shoulder hurts, well, I'm going to poke around and I'm going to see, well, where does it hurt? And I'm going to ask you, is there a movement or something you do that elicits that pain? Okay, demonstrate that for me. How bad is your pain on a scale of 0 to 10? And then we'll go through and we'll do a few injections. I like to follow that up with ozone because, again, what does ozone do? It helps with inflammation. So after we do several injections, then I'll have the person redo the activity that brings about the pain and see, have we decreased the pain? And they may go, oh, I feel it here more now, or, yes, it's better. So, and this is something we do on hips and shoulders and elbows. And I mean, you can do it in a lot of places, not just joints, but that is a common place. And again, you're injecting dextrose. Now you can put procaine in with it if they're in a lot of pain, because hello, that's, a nice little vacation from pain for just a little bit.
That's how I like it.
Yeah. So that's it's also called PIT, or perineural injection therapy. So it's, but it's more about dextrose, and procaine may or may not be there. We can also put in some vitamin B12, because B12 really helps with joint pain. So it's nice to add that little infusion in there. If it helps somebody with joint pain a lot.
And even with this, you're bordering on some trigger points or using some trigger points, but I've had this done before too. It's not that bad. It really isn't. It's pretty instantaneous relief.
Yeah. And that's the one where you should walk out feeling, okay, this feels better. Now, dextrose, because it acts as an irritant, it can intensify the pain for a day or two, but then the pain should decrease, pretty significantly.
Yeah.
Once again, it may be a one and done, and it may not be a one and done. Most of the time, people are going to need to have it repeated. But this is where there are no formulas, because we're all so different. We just have to, listen to our patients and say, let me know how you're feeling, or let's check in, send me an email in a week or whatever. But we're always, here at K6 Wellness, we are always getting feedback. It's like, I want to know how you're doing. Tell me if we made progress. And because maybe we need to reassess, maybe we need to change it up a little bit. And it's not the only thing that we do for pain, because, we're doing all kinds of things, lifestyle
working from the inside out.
Absolutely. Absolutely.
Yeah. So dextrose, super safe. I know a question that I should have asked you before, because a lot of people want to know about, we're going back to the ozone real quick. A lot of people insist the ozone is dangerous, and you kind of hinted on that a little bit. You kind of commented on that, but, can you just expound on that a little bit more for our listeners?
Well, I mean, I'm not an expert at ozone, but ozone, it gets, people equate it with pollution, but what I think of is, how it smells outside after it's rained?
Yes.
That's ozone, right? It's a beautiful, clean smell. Now, if you sniff that into your lungs, you're going to have some serious problems, because it will irritate your lungs. But so oxygen gas that's in the air is an O2 molecule. It's 2 molecules of oxygen. Ozone is O3. So it's 3 molecules of oxygen. It's very unstable. It doesn't last very long. So even when we're drawing up ozone, we do it right when we're going to inject, because it's going to dissipate into the air. That's not the natural state that oxygen is going to be in. But it does try to help neutralize pollution, and it in our body. I don't understand all the biochemistry of it, but it does help to decrease inflammation. The only thing to me is, don't get it in your respiratory tract, but people do insufflate it into their sinuses. We can put it in the ears for ear pain, ear infections. People do rectal insufflation, even vaginal or bladder insufflation. Now, we're not going to do the bladder insufflation here at this point in time. But all that to say, you can put ozone in a lot of places in the body. We also don't put it deep in the head space. Not really going to put it around the brain.
Look at people have used ozone IVs for a long time. I would bet, I would bet that a lot of our listeners are familiar with that, but that's going to be different than this experience as well. Because when you're doing it in the veins, that is powerful and potent, but I know from my own personal experience, it was too strong. It was too much.
Well, and I think that brings up a good point, because I don't think I would have had a detox reaction to ozone after just a single exposure. But I know for me, during my training with ozone, we took a lot of procaine and ozone in one short period of time, because part of your training is you have to take every single shot. So, and it's fair, you know, because we should know what we're doing to people by receiving it. And I felt like I had spent 3 days on a bender with cheap tequila. I have never felt worse in my life. And I knew what was happening when it happened. And I took a lot of it in my sinuses and around my sinuses. And I wasn't congested. If you ask me if I have sinus problems, I would never say yes. I don't really get hay fever. I sneeze every now and then. But I think I blew out 1975 that night with my horrible detox headache. And I was like, I don't even know what this stuff is coming out of my nose. And the next day I went to class, and I really felt like I had been partying all night. And I said, I need drugs. And I don't even take drugs. And you ask Elena, like I'm not going to take, I don't take ibuprofen, period. I never take Tylenol. I was looking for anything. I felt so bad. And actually what took that away was an IV push of procaine. So we did a slow push of about 5 cc's into my veins, and my headache went away and it did not come back. But that was definitely a detox reaction, but it was a whole lot at one time.
Right.
We're careful.
Right.
Yeah, we're careful. But some people like you know, you are more sensitive. So it's good to be aware of everybody's different. And it's good to start slow and low and just build up. And because if your result is not going to parallel how bad we make you feel. The whole point is to not make you feel bad. You don't have to feel worse before you feel better. And that doesn't just apply to ozone or neural therapy. That goes for anything that you're doing. It should not require some horrible Herxheimer or healing crisis in order to have benefit. Sometimes that just means you push too hard.
I think people need to hear that.
Binders are important too. So if you're doing a lot, then we tell people you need to take binders.
Yeah. Well, and that's where it is so important to have someone who knows what they're doing. And I can attest that you do know what you're doing. But how do you assess which treatment modality is going to be most appropriate or important for that patient at that time, you know, especially when we're talking injections?
Well, definitely taking a really good health history. Like, I want to know what's going on. How long has it been happening? What is the most limiting factor of this person's health right now? Because even though we do functional medicine, holistic health, whatever you want to call it, we're all about figuring out what started it all, right? We want to get to the causal factors, but that doesn't mean we ignore symptoms. And neural therapy, ozone, it's not just symptom management, but I do want to use something that is going to give you the biggest bang for your buck. So if somebody comes to me, for instance, and everything they're complaining about is reproductive, urinary, okay, I know that this person is going to be getting pelvic injections of some sort, right? If it's a person with autoimmune issues, which a lot of our people do have chronic illness or autoimmune problems that either they just have decided to live with, or they're suffering an exacerbation, then we're going to use a form of neural therapy that really helps to realign the immune system with what's going on. And so either a procaine push or something called autoheme, where we mix procaine with the blood and just do an intramuscular injection in the body. There's so many different things you can do. And just to kind of snap your fingers and get the get the system's attention, you know.
Yeah.
But yeah, it's understanding what the person is dealing with and what their goals are for their health, and then we decide, okay, let's do this. Or, you know, if it's an athlete, then and there were, they have an injury area, then we're going to definitely be focusing. I did one athlete and it was for one injury, but I couldn't help but notice all the scars around that injury from surgeries and stuff. I was like, we got to do all these scars. and it did make a difference. Like mobility was increased, almost immediately. And so that's going to help with healing,
Yeah.
So
Yeah. Well, I know that I've experienced more injections by you than I ever thought I'd let you do. And I have lived to tell about it.
we're so glad.
No, me too. And I got to say, I think the pelvic region injections have been the most impactful for me. Anyone who's listened to my story a little bit, I had a horse roll over the right side of my body when I was 17. And, then I had autoimmune and other things going on. And there's just been a lot of inflammation in the pelvic region for my entire adult life. And when we did the pelvic one, I mean, I just noticed so many immediate results. And I think it's the Frankenhauser. Am I saying that right? The Frankenhauser
Yep.
protocol. It is a gnarly injection, but so amazing. So Sharon, could you explain maybe that particular one and any other specific protocols that you're, especially excited about?
So Frankenhauser is, kind of legendary, right? And I think it's because it's the needle's so long.
Yeah, some people don't want to know that, but
We don't show the needle. But basically, you're going into what we're dealing with the Frankenhauser is dealing with anything in the pelvic bowl. So that's going to be urinary. For women, it's going to be anything reproductive, like women with endometriosis or chronic UTIs or what else? Even scarring from, you name it, surgery, from trauma. It can even be emotional trauma like dyspareunia or painful sex. That could be one of the indications. And so even people with vaginal discharge, and it's like, well, you don't have bacterial vaginosis, you don't have this, you don't have that, but there's always discharge. Or even headaches, migraines, traumatic brain injury, low back pain, any rectal pain, infertility, irregular periods. And then for men, we do it for BPH, enlarged prostate, constipation, diarrhea, low sperm count. So fertility issues with men as well. And then even, and men, we don't think of men having sexual trauma in their history, but they do. And this is another indication. And then again, low back pain, testicular infections, men get UTIs, so bladder infections.
basically you name it. You name it. This can
If
help
it
in that pelvic
resides in below the belly button,
region.
that's kind of where we use the Frankenhausen or Hauser, excuse me. And it is. It's a big shot, but it's also something that is going to bring about a big change. So pelvic floor issues, that's one thing that we're getting people in for. They have pelvic pain, and then some injections are guided by ultrasound, and they're real high tech and difficult. And the Frankenhauser very, very expensive. Frankenhauser is simply, established, it's simply performed, and it's very effective. I've had women in the throes of menstrual cramps and we're able to do it, and they get immediate pain relief. We've had emotional reactions from doing it. There's just, and then we have people who are like, I don't know, they have such chronic issues and they're waiting, as it's going to be a series. Cause again, these are seldom one and done things, but it depends on the person and what they're being treated for.
Yeah. And it can be very complementary to pelvic floor therapy as well.
Absolutely. And I think even following surgeries, like endosurgery or hysterectomies, because what we don't stop and think about is every time you cut something out of the body, every time you cut into the body, you're cutting fascia. You're creating a scar. you're creating an interference field. And with the Frankenhauser, you can actually feel as you're injecting. It was described to me as lacy. It'll feel lacy because it should feel like butter when you're going in. And I call it crunchy. Like there are some people, it's like, ooh, this is not butter. This is more like Rice Krispies. and that's where there are adhesions, and it's a beautiful, simple thing because we can inject right where we need that, right where we need to reset. So that's the Frankenhauser. And then there's another way to do it where you go in a little lower. But it's something that we are so careful. We're so careful with our patients because first of all, we want you, if you're coming here, to feel comfortable. We want you to feel safe, and we want you to feel hopeful, and I think that you need those things for healing to take place no matter what you're doing, whether I'm massaging you or sticking a needle in you or telling you to take an enzyme. You need to feel confidence. And we try to provide a safe space. We try to provide a very calm and easy environment for people to just feel comfortable and have a little time and space to absorb the treatment and before you just get up and go about your day. So, yeah.
Well, and I was going to ask, but you kind of answered already, how an individual would know if they need neural therapy.
You need it.
Really, it's for anything. Everyone needs it. I mean,
you
right?
do. I mean, I'm not going to say need, but I think
not needs, but everyone could benefit
from it.
Yeah.
Yeah. Whether you have headaches, sticky lymph, reproductive problems, gastrointestinal, because we haven't even started to talk about GERD or liver problems. There's lymphatic. We do a lot of lymphatic work with neural therapy because it really helps to move the lymph and improve drainage.
Yeah.
Yeah. Yeah. And then just the whole pain. Pain is such an interference to life.
Yeah.
So, yeah,
I mean, everyone's experienced it one way or another. And when you're in constant pain, you're going to be more tired. You're going to be more grumpy. You're not going to think as clearly. So to be able to get a pretty immediate relief from that, there's not much like it. And, once again, it doesn't replace all the clean living we have to do. I don't think anyone's going to listen and think, oh, they can make all the bad choices they want and get neural therapy and be fine. But it is just really, really great to know that there's this simple little tool that we can use to get a little relief with all the challenges in life. And
yeah, and it's really exciting to be able to do something to somebody in real time. They experience benefit, and that's something that neural therapy can provide, or ozone, or prolozone, where you're doing the prolotherapy and adding ozone, being able to help somebody feel better in the moment. And then even if it doesn't last all the way, to be able to say, okay, this is a tool that I'm going to get to use going forward as we're unwinding everything.
Right.
Yeah.
Well, and that's where I think we both strive to educate our clients. It's so important that people know what their options are, because that does keep people hopeful to know that there's other options, right?
Yeah. And that's why we're always learning, because there's no way we can ever do all the things. But our philosophy of health is to have things that are accessible, that are affordable. And that's why when you come here, we're not just, buy this $1,000 of supplements. I hope that's not what people get when they come here. But, we need you to do these things at home. We need you to do these practices at home. We need you to sleep. We need, it's the way you live your life. It's our thoughts. It's the people that we surround ourselves with, but then it's also the therapies that we provide ourselves. Self-care, right? Dry brushing is one of those things. Dry skin brushing, getting a massage, getting a facial, whatever, going on vacation, turning off
Yes.
screens. There are so many things that you can look at as therapeutic. And for us, for sure, this is, neural therapy, using the different injections can really go a long way.
Yeah.
So I think, whether we're, getting somebody out of a funk, or processing grief, or improving fertility, providing menstrual cramp relief.
That one's a huge one.
Yeah,
That's
for
huge.
sure. That's, there are so many things that so many benefits, I guess, to be had from using things like this. And the Germans are the masters at this. And so it's so exciting, and we're going to keep adding to, I'm going to keep learning. We're going to keep being innovative with the therapies that we bring to K6 Wellness Center and to our clients who, just drive us to do more. And I cannot say how encouraging it is. People tell me, I can just tell that you're passionate about it and that you love it. And I do, but I love it even more when our clients are passionate about it. And, it's one thing, like if I remember to ask you, hey, how did your blah, blah, blah go? Or how was things? But, it's another thing when I'm so passionate about what you're doing. I'm like, Elena, how was that class you did? Or how was that, whatever, how's this going? It means something. And I think people are taking their health more seriously. I'm so excited to see how healthcare may change, in the coming years, and to have more innovation, not necessarily things that have never been seen before, but going back to the time-tested, the age-old principles of health, heat and cool and water and wind and food and rest, all of those just most basic things that all play a role. And neural therapy does play into that.
It complements it, because
It does.
you can do all the other right things and still need something to get you to that next level. And that's what neural therapy has been proven to be for so many people already. And I'm excited for all of our listeners who are at least local. If you're not, come visit us, come experience this. It's incredible.
It's allowing your nervous system to go back to that place where it's not disrupted, and you're not just staying in the sympathetic fight or flight or fright state of mind all the time.
Yeah. Well, that has been so helpful, and it just seems like a perfect place to wrap this up. We hope you found this information valuable, and we'd love to hear from you. If you watched the episode on YouTube, please like and subscribe to our channel, but also check us out on Rumble, Facebook, and Instagram. And if you'd like more information on how to take better care of your health, visit k6wellness.com to schedule an appointment. Until next time, take care of yourself, because your health is worth fighting for.